Welcome to Spring LIB.
For this question, we have a patient that has subsequent infections with the same type of bacterial species, Streptococcus epidermidis. So here, what's happening is they receive this infection, shown by the fever and those positive blood cultures, meaning this infection is inside the blood or a bacteremia. They have an antibiotic treatment and are cured. However, the infection arises again, indicating that the blood-borne pathogen is still present and is still causing the infection. So here they're introduced a new catheter and the infection again is cured and no longer comes back. So here the important things to consider about this case is the use of an IV catheter to deliver medications. And this is simply just a needle that's inserted into the skin for a long period of time to deliver those medications and chemotherapy treatment. So here, what likely occurred is after the introduction of the needle into the skin, some Streptococcus epidermidis from the patient's skin likely was introduced into the bloodstream along with it. So here you would have a strep epidermidis colony being introduced into the skin and into the blood. What also happened is since this needle or the catheter was continued to be inserted as the patient received their IV therapy, the Streptococcus epidermidis formed what we call a biofilm, which is a film-like layer of bacterial growth. So here, through their treatment course with antibiotics, this Streptococcus epidermidis biofilm was still present. So when we remove the antibiotics and the bacteria is no longer being attacked by these antibiotics, the biofilm was able to reemerge and cause the subsequent infection. From there, they ended up removing that catheter in order to introduce those oral antibiotics. So here we no longer have this IV introduction of the bacteria through the biofilm on that catheter. So here the most likely explanation is that a biofilm formed on this IV catheter they were using to deliver those medications and fluids. And because we removed that catheter in order to give them oral antibiotics instead, we removed that source of bacteria, allowing the antibiotics to work more effectively and cure up and cause the finalized cure and no longer reinfection of the patient.